my name is Chelsea, and I'm here today to insert a nasogastric tube. So before I do anything, I'm going to verify the doctor's order, make sure I have the right patient and the right order. So this patient is having a nasogastric insertion to relieve the pressure in their stomach. So I'm going to come in the room and provide for privacy, and I'm going to perform hand hygiene. Hi, Mrs. Smith. My name is Chelsea. I'll be your surgeon's nurse today. I'm just going to go ahead and confirm your name and date of birth. Okay. How are you feeling today? Are you in any pain? So I get a numerical rating of their pain, have them talk about the quality of their pain, specifically in their epigastric area, any nausea, anything like that. So today, there's been an order put in to insert a nasogastric tube. So what that involves is inserting a tube into the nose, down to the esophagus, and into the stomach. It's going to be a little bit uncomfortable, but what it's going to allow us to do is take some of that fluid and suction it out so it's not giving me so much pressure. Do you have any questions? Okay, so while I'm advancing the tube, at any point, if you're uncomfortable, just go ahead and raise your left hand, and that will cue to me that we can stop the procedure and give you a rest break, but it will be fairly uncomfortable, and you may feel the need to gag, but that's fairly normal, and I'll be right here for you. So, okay. So I'm going to raise the bed to a working height, and I'm going to make sure that the head of the bed is 90 degrees. I'm going to put the pillow right behind him, and I'm going to have my my tube ready for me. First, I'm going to check their. I'm going to put on gloves. And with my pen light, I'm going to actually have them, ma'am, can you squeeze your nostrils and then sniff in on one side and tell me which one is less clogged or which one passes air more easily? And so the patient's telling me that her left nair is passing air more easily, so I'm going to go in through that side. Okay, so it looks good, looks clear, I'm going to go in through there. So the way that I'm going to measure this is I'm going to start from the ear, and I'm going to start from the tip of the nose, and go to the ear, and then I'm going to go from the ear to the tip of the sternum, right at the xiphoid process, okay? And then I'm going to take my pen, and I'm going to mark that with indelible ink. Okay, so that's nice and visible for me. And I'm going to lubricate that 4 inches. And, okay, so I placed a towel over the patient's waist. I have my emesis basin here to catch any vomit that comes up. I have measured this. I'm going to have the reflex valve attached. And I'm going to attach the 3-way stopcock and make sure that it's in the off position. Okay. So, okay, so I'm going to have them put their head back. So can you tilt your head back for me? Okay, so I have this nice and moved up, and I'm going to basically just aim it downwards and just keep advancing it. Not that far until it's reached. Have my pen light out. Do not let go of it. And I see it in the back of the throat there. Okay. So I'm going to have the water handy. I'm going to have you just sip, and every time you sip your water, I'm going to further advance the tube down. So sip, 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 sip. Okay. So in a real human, it'll advance probably much more easily. But in this case, it's a rubber human, so it's a little bit more awkward. Okay. do we want to mark there? Okay, so I'm going to have my tape ready here, which I already spliced in half. And I'm just going to butterfly it and do a little wrappy-do here. Okay. Okay, you did great. Okay, how are you feeling? Okay. They were uncomfortable, but they survived, and it's all good. So, now that that's secure, I'm actually going to go to the other side of the bed with my syringe, and I'm going to aspirate the gastric contents. Make sure I'm in the right place. Okay, so I'm going to I'm going to make sure that this is off in the right direction. I'm going to have this ready. I'm going to take this off. I'm going to stick this in, and I'm going to aspirate. I'm going to aspirate a little bit, and then I'm going to turn it off. Okay. And then I'm going to pull it out. I'm going to keep that there, and get my orange doodah here and put it back. Make sure that it's positioned up here just for a minute. Okay, so I'm going to put it, so this is just a small amount. I don't need to put it back because it's such a small amount of gastric contents. And I'm just looking at the acid paper here and measuring between 0 and 4. It looks like I have a pH of 2, so I'm, in fact, in the stomach. Okay, so that's good. Okay, so now I'm going to connect this to suction. I am going to take this and connect it to suction, and whatever the order is for, this patient is going to get low intermittent suction, so I'm going to go ahead and turn it on low intermittent, and let's see, I'm going to place it in the open, so this is open to suction, and okay, so what I'm going to do is I'm going to make sure that this is above the patient's heart here. You can put it above here, just make sure when they move around, it's not going to move around. So I'm going to take a rubber band, and I'm going to position it around the tube. So then I can fasten it to them and safety pin it to them, like that, like so. Make sure that is in a position that is okay for them, and then I'm going to go ahead and provide some oral care. Okay, just clean out this person's mouth, just to make them feel a little bit better about what just happened. Okay, have them swoosh. Okay, we'll get rid of all this stuff, all this garbage. Okay. Okay, so I'm going to get rid of my trash. And is there anything else that I can do for you while I'm here? Okay, this patient has everything they need. I'm going to perform hand hygiene. I'm going to lower the bed all the way as far as it can go. And I'm going to make sure that this patient, I'm going to order the chest x-ray to make sure that the tube is in the right position, and then I'm going to document everything that I just did. And that's it.